Welcome to the Ipsos Public and Society podcast, and Happy New Year. My name is Keiran Pedley. On this episode, we're going to be doing a deep dive into the key themes and trends that affect our society as we head into 2023. And to do that, I'm joined by my colleagues, Trinh Tu and Alex Bogdan, to unpick the recent Ipsos publication, Understanding Society, which looks at key topics such as the cost of living, how we combat net zero or meet that net zero target, and also the impact of all of this on our nation's health.
Hi, lovely to be here.
Hi, Keiran.
So, Trinh, lots to cover in this episode. I mean, where do we start? So could you explain maybe a bit about what Understanding Society is and what it's trying to achieve?
Yeah, well, Understanding Society is our thought leadership publications. It's something that we're really incredibly proud of. And each year we choose a topic that's really defined our society, and we zoom in on it using our vast data and also leveraging our expert interviews and external publications to pull together what it actually means for policymakers and policymaking going forward. So this year, obviously, the cost of living has dominated society, and it looks set to continue to be ever present in 2023. So we thought it was very timely to actually pull together all the research evidence we hold to actually look at what it means for different audiences and different stakeholders within the UK.
And yeah, it's obviously a great publication, and we'll post the link to that in our in the accompanying sort of audio and the description that comes with the video to this as well. But I guess I'll come to you both in turn. First of all, I'll stay with you, Trinh. I mean, looking at the various articles and interviews, I mean, what stood out to you when looking at this, looking at our Understanding Society publication this year?
So there's lots and lots of articles in Understanding Society, and the reasons why we focused on quite a number of issues is because there's, much of the debate this year has focused on energy and food, but actually the impact of the cost of living is much, much wider than that. And the one thing that I suppose has been talked less about is well-being. So for me, a lot of focus has been on the economic crisis and the financial crisis, but actually financial crises have implications for our well-being and how our society and how our people operate. So that's one thing that's really stood out for me, is that when people are really, really worried about their income, their financial insecurity, that has an impact on their life satisfaction and their well-being. And our financial well-being tracker makes that very, very, very clear. So that's definitely one of the things that stood out for me. And obviously, our well-being is contingent on things like health, welfare, housing, and all those things. And that's how, we dive a little bit deeper on those other topics and in the publication, because we feel it's really important to actually focus on the broader issue. How about you, Alex?
For me, I think one of the things that stood out is just how much, even though I think most of us are in one way or another affected by the cost of living crisis, but actually it's always those most vulnerable groups in society that are more likely to be affected. I think the interview that we did with Mike Brewer from the Resolutions Foundation actually was quite insightful in looking at how people who are on lower incomes are much more likely to be affected, because a lot more of their incomes will go on things like energy or heating or food, and those are the areas where we've seen such high cost increases. And throughout the pandemic, I think what we were seeing during the pandemic, a lot of people who are on higher incomes maybe were more likely to make savings because they weren't going out as much, they weren't spending as much, they weren't going on holidays. But again, it was those more vulnerable groups that were less resilient because they weren't able to make all of those savings. So now they're coming into this crisis just having less support and being less resilient. And I think one of the articles where you can really clearly see this is on the article on food insecurity, where food is, inflation levels for food have been absolutely astronomical. It's one of the things that is mostly driving inflation, and it's those more vulnerable groups, households, that are having to spend more of their money on food, and they don't really have an opportunity to be strategic and maybe cut costs because they're already purchasing probably the cheapest available brands and buying at the cheapest supermarkets, whereas other people may be able to maybe cut down on costs, maybe switch to a cheaper brand or switch supermarkets. For a lot of people, that's not really an option. And I know from economic analysis that we've seen the price differential between the cheapest and the second cheapest food item in a category can actually be quite big. So again, they just don't necessarily have all of those tools that other people might have to help with some of these pressures.
And I suppose just Trin, this does show the value of insight and data when it comes to sort of unpicking the cost of living crisis, because I'm minded to remember some polling we did for Sky last year where we were looking at people struggling to pay their bills, and around 1 in 3 said they were struggling to pay their energy bills. But then when you break that down in terms of the behaviours people are exhibiting, there's a wide variety of steps people are taking in the cost of living crisis, ranging from shopping around, changing suppliers maybe, or socializing less, as Alex has alluded to, right through to skipping meals and getting into debt and having real well-being issues as a consequence of that, but also financial issues too. So I suppose there's a real need for policymakers to try and unpick some of the detail here, isn't there? And I suppose that levelling up is another sort of broader trend or a broader theme that we could talk about too, because I guess different areas of the country are affected differently by the cost of living and also policymakers' decisions. So it's a real challenge for policymakers, isn't it?
Yeah, definitely. I mean, the thing that really struck me when you read through the various articles that actually, some areas is actually young people who don't have a lot of savings, and they've been affected, and they're one of the groups that are most worried actually about the cost of living when we look at the different groups and the level of anxiety they feel. And then there's also another one of our articles focusing on people who live in rural areas, something you don't actually think about very much, but they also have very, very high cost because they're already paying the high cost to start off with, because it's more difficult for them to access. So people living in the Highlands and Islands of Scotland, they have difficulties accessing cheap food. They have difficulty accessing cheap energy. So this is just another layer on top of that. And then something else you don't think about is actually people living in Northern Ireland. So one of our articles focus on people living in Northern Ireland who actually, because of the political stalemate at the moment, they don't actually have a government. So they are feeling very, very anxious. And they also happen to be the group that spend quite a lot of their disposable income on food and energy as well. And you mentioned differences by and levelling up. So when we look at regional differences, we do find that people who live in the northeast, for example, feel most vulnerable and feel most anxious about the cost of living compared to the people living in London and the southeast. But that's not to say that everyone living in London and southeast are unaffected. But when you look at a regional overall level, we can see those differences. And so that does have implications for levelling up and what the government's going to do to try and, reduce the level of differences between people living in different parts of countries. And the public, through our data, are not convinced that the government is going to succeed in doing that. But at the moment, it's incredibly important that levelling up does not get lost in the midst of all of this.
So let's deep dive into a couple of the biggest themes that are covered in this publication. And again, links in the description below, and on the accompanying audio on Twitter and elsewhere, and wherever you get your podcasts. We'll start with net zero. Obviously, a huge topic. I'll stay with you, Trin. I mean, the government's legally bound to reach net zero by 2050, but I suppose one of the age-old, well, you tell me if this is true, one of the age-old assumptions with climate change and the environment and net zero is that when there are, people are supportive, but actually when there's a big economic crisis, or in this instance, a cost of living crisis, it almost gets put on the back burner as a priority. So is there a risk that sustainability is deprioritised on the altar of cost of living, do you think? I mean, what does our understanding society tell us about that?
So I think even before the cost of living crisis, people were under the impression that actually sustainable behaviour is expensive. So those kind of perceptions already existed before we faced the cost of living crisis. But actually, what we've seen, and the data is showing in Understanding Society and in our Net Zero Living publications and webinar earlier this year, is that people are changing their behaviours. The changes they're making in order to save money are actually also sustainable behaviours. So they're green behaviours. So they're cutting back on energy consumption. They're cutting back on waste, food waste. They're using green transport modes more, and those things they're doing them not because they're necessary to see as a kind of environmentally desirable behaviour. That's not their utmost priority. Their utmost priority is actually to save money, even though they do care about the environment as well. But by doing that, they're also benefiting the environment. So the data is showing that actually the two can coexist, and they actually reinforce one another rather than it's either saving money or saving the planet.
Yeah, I was going to say that. So actually, even though you're absolutely right, and the main driver of these behavior changes that we're already seeing is cost, and it is people's anxieties about affordability. But actually, they do realize that, and they tell us in all of the data that we have. Being environmentally sustainable is a very important second driver for people. They are aware that these things are also environmentally sustainable, and they're very keen that they do make these changes for that reason as well. So people do recognize the double benefit of it, and they're quite keen to do things. They have expectations of themselves as well. They want to be making these changes for both reasons, really.
But presumably, I mean, it all sounds great for those who advocate for net zero, but presumably there are different degrees of intervention or behaviour change that have different levels of impact on actually reaching that target. And presumably people in the public have different levels of acceptance or sort of enthusiasm for different levels of behaviour change too. So I don't know, Alex, is there anything in what we've done or in Understanding Society that points to that? So like perhaps if certain behaviour is okay, we'll do that, but I'm not quite sure about this one. And how does that relate to actually what has the biggest impact on reaching that target?
Yeah, absolutely. So what we're seeing is perhaps surprisingly, or it was for me, that diet related behaviors seem to be a lot easier for people to make. We're seeing people cut down on meat, on dairy, whereas travel related changes seem to be less popular. We're not seeing quite as much movement or intention for people to give up their cars or to adopt active travel as much. And one of the reason it might be that actually the people who are more likely to make these changes because they have an environmental mindset are the groups who are already engaging in all of these behavior. So we have groups like women or younger people from an ethnic minority background. They're more likely to walk, cycle, or use public transport. So there's really, I think, a bit of a ceiling now where the next step would be trying to convince other groups, more difficult to convince groups, to also adopt these behaviors if we're going to reach net zero.
And to that point, Trinh, I mean, how does government and how do policymakers make sure that some of these behaviour changes are embedded rather than sort of the New Year's resolution that we're all making at the moment that doesn't last past Easter, if that far, frankly, for anything like me?
So I think there's a number of ways. I think communications is really important, and I don't think we should dismiss the fact that people's perception is that these changes are expensive, and some of them are expensive, and we should be really, really honest about that. So some of the bigger changes that people can make but are currently not making is like things like insulating your homes, switching to electric vehicles, which is really expensive. adopted using heat pumps, for examples. So those things, they have very large upfront costs, and government should be very honest about some of those costs, as well as the longer term benefits, and also make use of subsidies. And, you know, some of the subsidies already exist. So I think it's getting people who have already embarked on this journey to actually make some of the bigger and more lasting changes that will actually, you know, help us to meet our net zero commitments, and being very honest and providing support and subsidies where possible. And then I think the other thing that we found is actually the co-benefits, emphasizing the co-benefits of the actions that people are making. So, you know, if you walk more, then, you know, it's healthy for you, you save money, but actually you also save the planet as well. So those actions benefit you and the wider society as well. So I think those are a couple of things that they could make. And then I think the third thing, which is probably a little bit more controversial, is you know, people's behavior, and you and I, the things we do, you know, their habits, we just do them automatically. And perhaps there is a case for actually perhaps removing some of those choices that we have. So, for instance, having plant-based diets and offering vegetarian food, perhaps have that as a default in some of the public places, in, you know, school dinners and things like that. You know, when we did the automatic enrollment a while back, everyone was like, "Oh my God, no, you know, you can't do that." But by automatically enrolling people in pensions, and the onus is actually on them to then opt out, we managed to get that done really successfully. So perhaps we need to think a little bit more creatively about how we go about changing people's behaviour in a more directive way.
Alex, any thoughts on that? I mean, it does. The co-benefits really stands out to me, because one of the things I remember from focus groups years ago is that, you know, to some people, you know, saving the planet, to most people, saving the planet is a great laudable aim. Don't get me wrong, but for some people, they feel like, as an individual, how much can I really affect that? You know, whereas actually, if you build some of this messaging in around, well, yes, you do that, but actually, you also have your own benefits too. That probably is going to be more persuasive.
Absolutely. And what we're seeing in some of the really interesting research we did for CAST, for the Center for Climate Change and Social Transformation, is actually people can be very easily convinced by by arguments around economic costs. So it's really important that we challenge those, and we do talk about, or policymakers talk about, some of those co-benefits, because, as I was saying earlier, people do recognize the environmental benefits of these things, and they are actually quite keen to implement them for that reason. It's not that people don't care about being environmentally sustainable. It's that the cost of living is a priority. It might always come first, but environmental benefits are very much a very close second when it comes to some of these behavior changes that we're already seeing people make. So there's no reason why we couldn't push that a bit further.
Yeah, it's going to come down to that cost thing, isn't it? Because ultimately, it's not hard to imagine, the longer the cost of living crisis drags on, that there will be the risk of doing what I always do and bringing it back to politics. There'll be someone that says, well, let's delay that target. Let's cut those green taxes so that we make people better off. So there's always these things get pushed back on too. So we'll have to see how that develops in the future. Another key topic, I'll stay with you, Alex, was around health outcomes and the cost of living. So if you think about the long-term consequences of the current crisis, there's a growing recognition that sort of poverty and poor health are linked. This isn't a new idea. But are there implications for people's health? What does Understanding Society tell us about the links between health and the rising cost of living?
So indeed, as you're saying, we've known for a long time that there's a clear link between poverty and health outcomes. And we know that from the academic literature, but also from our own GP patient survey. So we've been running this for, I believe we're in our 17th year now, a large survey for NHS England, where on a yearly basis we collect hundreds of thousands of responses from people who have accessed the NHS recently. And again, what we're seeing there very sadly is that people who are in deprived areas, they're more likely to be reporting negative experiences when making appointments, either in even being able to access their GP, but if they do access them, then they're more likely to report negative experiences at their GP practice. And this is in contrast with more affluent areas where we're not really seeing that. People are less likely to have these negative experiences. So this is really very much affecting people's satisfaction with the NHS, for example. We've seen during the pandemic, we had a bit of a rally around the NHS effect where people were very supportive and very understanding and very willing to compromise when it comes to health services. Whereas now I think the expectation is very much that we should be returning to business as normal, but it doesn't quite feel normal anymore. It feels like we're not necessarily returning to any sort of good outcomes. So we are seeing in a lot of our polling that satisfaction with the NHS itself has gone down. So people are really noticing the fact that there is this link between where they live and the quality of care that they receive.
Yeah, I think that all chimes with some of our Ipsos Issues Index and some of the polling we've been doing for the media around waiting times, waiting lists. I mean, I think it's no surprise to anyone that listens to or watches public opinion that the NHS is never far away from either the political debate or the top of lists of concerns people have. But I think what's taken me aback a bit in the last few months is the intensity of that concern. So it might be that you get 8 in 10 that are concerned at waiting lists being too high, but that strength of concern really shines through. And it's never far away, as I say, from the political agenda. I mean, Trin, what can the NHS do then to continue to provide good quality care? Because it sounds to me like resource is obviously a huge issue. There's this backlog from COVID, of course. We shouldn't forget that, alongside the cost of living crisis. So it's a real challenge, isn't it?
Yeah, it's a huge challenge. You know, as you said, the NHS is never far from our issues index as a thing that, you know, the public really care about. And we have seen it jump actually in the last couple of months. So it's now just below the economy and inflation. So it's incredibly important to people. In terms of the actions that the government can do, it's like you say, it's incredibly difficult. It's always about, the first thing people always talk about is funding, more money for the NHS. But actually, you know, there's a workforce issues as well, which, you know, funding alone can't tackle. We've got shortage of doctors, nurses, healthcare professionals. On top of that, we've also got the strikes going on at the moment as well, which is also contributing to the NHS's ability to deal with the backlog. So funding, I think that was a little bit welcome in the autumn statement, but it's obviously not the only thing. The other thing that the government is doing is the introduction of the integrated care system, which came into effect, I think it was in July last year. So they've been set up to basically tailor services to meet local needs. So I think that's really, really good. But it's still really early days, and they still got to work out how, you know, what the needs are in their local areas and how to go about it. So that's going to take a little bit of time. And then the other thing, I suppose, is to focus on prevention. So our research with the public shows that the public is highly supportive of preventative measures. So actually preventing people from ill health in the first place. And I was very, very surprised actually that they actually were more supportive of that than treating ill health. So when you give them the choice of actually, you know, where should funding go? Should it be dealing with prevention or dealing with actual people who have ill health already? They were more leaning towards prevention. But, you know, that's incredibly difficult when you've got a massive, massive backlog, which is affecting people's lives on a daily basis. So I really don't envy the government in terms of, you know, what the choices that they have to make. It's gonna require some difficult choices for the government and for the public as well going forward.
I mean, you mentioned earlier in passing strikes. I thought I'd spend a couple of minutes just going over public opinion there, because it is something that is ongoing at the moment, primarily with the rail workers and the nurses, but other groups of workers too. And just you can find more of our research on our website. And for those of you that follow me on Twitter, I tweet about this a lot, at Keiran Pedley. But one of the if we look at some of the our polling on strikes, 50% of Britons support nurses that are going on strike and 34% oppose. But that level of support was 59% in November. When you contrast that to rail workers, 30% support the rail workers going on strike, 36% oppose, so much more split. And that support is down from 43% in September. So a few numbers there, but I mean, what do we ultimately see? What we ultimately see is there's broad support for the principles of striking. So you'll get around 8 in 10 tell us that it's important to have trade unions representing workers' interests and so on. But what you've kind of seen from the numbers I've described there is that the level of public support for actual specific action depends a little bit on how disruptive that action is. So bless the public, they like the idea, they sort of respect the idea of strikes until it causes loads of disruption that they don't want. But also it depends on who's striking as well. And so one of the things we track over time is whether the public support or oppose different groups of workers striking. And NHS workers, such as nurses, firefighters, teachers and postal workers tend to get solid numbers more in favour than in opposition, in contrast with, say, civil servants or barristers, bottom of the list, where there'll be more people opposed than support. So attitudes to strikes and to kind of industrial action do sort of vary a bit by who's doing it and kind of what the implications of it are. And I think that whilst that isn't a big focus of our understanding society piece, I think it does speak to ongoing sort of industrial disputes, which feeds into a wider theme around the future of work and remote working post the pandemic, and how we all log on and off for those of us that deal with emails and things of that nature. So there's a whole other theme and topic around the future of work, around the cost of living as well, and not least because our research shows that a lot of younger people in particular are taking on more and more work to try and make ends meet. So some interesting topics there. But just to sort of take it back to the beginning, if you like, Alex, I'll come to you first for any sort of closing thoughts. Lots of topics that people can unpick in our Understanding Society publication. You talked about some of the key ones there, but I mean, what would you like to say in closing?
I think absolutely a lot of different topics are covered, and it's striking how interlinked they all are. We were talking about health just now, but the food and food insecurity has massive implications on health, and that's also going to massively then link up with inequalities generally. So I do encourage people to go and just explore all of the articles on the website. And then probably I would highlight some of our other polling as well. Our financial well-being tracker looks into some of those well-being and anxiety issues that Trinh was talking about earlier on. I would encourage people to find that on our website, because it really shows how we're all affected by it, but even though there'll be some people who are generally struggling, absolutely, but the level of anxiety across society I thought was quite striking.
Yeah, it's enormous. I mean, we do a monthly political pulse that shows around 2/3 of the public think that the country's heading in the wrong direction. There's real anxiety about the way things are going, and that permeates everything from a policy perspective and also a sort of political perspective as well, which really does, I guess, Trinh, in closing, show the scale of the challenge that policymakers face in the aftermath of COVID and now the rising cost of living.
Yeah, no, I think the challenge is enormous for policymakers, but I also see this as kind of like an opportunity. We see a lot in our research that actually there are moments in life when people are more receptive to behaviour change. And I think this, unfortunately, it is the cost of living crisis, but it's also an opportunity where people will have the potential to make changes that will have an everlasting impact on our environment and the way we live going forwards. So in their attempt to try and save money, they will also be helping us to reach our net zero goals if we if we manage the process right, and if government provides the support, the leadership and the communications, I would say that the thing that has really, really struck me from reading the articles and all the work that we've been doing, including the financial well-being, where we actually segment different groups in society, is that this has affected, I think this is the first crisis you can say that's affected everybody. It's affected public services, affected individuals, affected businesses. Everybody is affected, but in such different ways. And we have to, policymakers have to dwell deeper and actually look at the different impacts of the different groups. And policy has to be tailored. We can't have a one broad brush, tailored to the different impact that different people are experiencing. And then I think the second thing for me is that policymakers have got to focus on some of the big long-term issues. You know, the energy crisis is really important. Food security is really important. But health, education, all the things that the public care about. And we know, you know, Keiran, you know from the issues index, the issues that lie underneath. And the minute, you know, they're quite unpredictable and they can become top priorities very, very quickly when things happen. So levelling up and those underlying society issues, we can't ignore them. And focus exclusively on the short-term issues that are with us. We need to think about some of those longer-term issues and deal with them as well. So that's the second thing for me. But there's loads in understanding society. There's also the levelling up index that we have, which is, you know, you can have a look at the regional differences of how this is affecting different groups of people. The wellbeing tracker, which has a segmentation. And then I think the final thing is our net zero living, which I mentioned earlier, because that is a massive piece of work that we carried out, which actually looks at public receptiveness to different policy levers. So, you know, that's really useful for government in terms of looking what works with whom.
Well, certainly lots for policymakers and government to unpick as we head to the middle of the 2020s and beyond. We'll leave it there, though, for today. For now, thanks to my colleagues Trinh Tu and Alex Bogdan for joining me to unpick some of that. If you liked what you heard on the Ipsos Public and Society podcast, please do like and subscribe and tell a friend about us. And if you're interested in some of the research that we've talked about today, then you can find links to some of that material in the accompanying audio and video copy that goes out with this show as well. But for now, thanks for listening and Happy New Year.
Happy New Year.
Happy New Year.